Hello, welcome to the Love Thyself channel. So, this week, the theme is going to be about self criticism. So, this one will be a little bit different because it'll be somewhat personal. Initially, I was going to talk about, the standard topics about self criticism, how it can harm our self esteem and increase stress and anxiety, and also limits our personal growth. It can strain our relationships, also reduce our mental resilience, all of that, which is true. But then I got faced with a personal situation where I had to determine, was I being too self critical on myself? So, to give you a quick little backstory, um, recently I went to the doctor, my women's health doctor, and this is somebody I've been seeing for quite some time. And it's no secret, I've always had like a struggle with my weight being up and down. And since I've gotten older, now I'm 51, the weight doesn't come off like it used to be. I don't eat terrible. I have treats moderately, nothing, super duper. So we're talking, and he's like, okay, everything's checking out good. Your blood pressure's okay. I want to get some labs and things like that. And he's like, you're pretty much having the same lifestyle, or, you eat in moderation and things like that. And I said, yeah, everything's still the same. So he goes, well, did you want to try Ozempic? I was like, like, where did that come from? So he goes, well, you know, maybe it's just that your body isn't doing what it needs to do to sort of break down the food faster to make sure that you're not holding on to fat. And so I was like, okay, that's a risk because, with any medication, you're going to have some kind of risk. So I was like, well, like what are some of the standard, risk factors? And so he goes, well, it could be nausea, constipation, diarrhea, pancreatitis. I'm like, pancreatitis? He's like, well, it's like less than 1% of the people have that, but you can lose 20% of your body weight. It's an injectable medicine that you do once a week. And then I started to think, like, am I even considering this because I'm being too self-critical, or am I thinking about the health benefits that I can get from this? Because now, since I've gotten older, I've noticed that since I don't move around as much, when I do sit down, like I could sit down for 10 minutes. When I get up, my joints are struggling, for me to move about. And I said it to my husband like a while back. I said, well, you know, it can't be good for my joints to have, this much weight on them. I'm like, I mean, normally I would say that I'm that thick and solid composition, like literally a size 8 for me would be, I'm weighing 185 pounds. I'm naturally tall, like 5'7", 5'8", but like literally dense, bone structure, like thick and solid, really. So I was like, okay, let me see. So he gave me a list. So I brought the list, and he goes, okay, I'm going to give you 4 GLP-1 medications, and I want you to call your insurance company and see which ones are accepted. So I said, okay. So he gave me Ozempic, Wegovy, Mounjaro, and Zepbound. So I called my insurance, and the Ozempic and Mounjaro are covered, but you have to get prior authorization. So I'm thinking, man, do I really want to do this? So I had to evaluate, like, is this, because I had already, just chalked it up to, okay, I'm going to be, somewhat of a bigger girl, it's going to come off much slower, even with me, eating right, and, having moderate exercise. Now I could exercise a little bit more than I do, truth be told, I could be more active, but it's just not coming off like it did 30 years ago. So I said, well, maybe, I'll go ahead and consider it. And I'm like, okay, well, typically, how long are people taking the medication? And he's like, oh, they never stop. I'm like, so you're just taking this forever? So he goes, well, there have been some patients that, they stopped, but then when they came back, the weight came back also. So, in my mind, I'm thinking, okay, I've been pretty much plateauing at the same weight. Like the way that I eat, I'm not really gaining any more weight, but I'm not really losing the weight that I should either. So I said, okay, well, maybe I'll take it until I can lose the weight that I want to lose and then go ahead and maintain that, since I'm pretty decent about maintaining weight. So he goes, well, yeah, you can lose up to 20% of your body weight and so forth. So anyway, after the evaluation, I thought the risk of having more weight on me can't be healthy either. So like I said, I had already chalked up the whole, you know what, I'm okay as far as self-worth, self-esteem, and so forth a while back. So I came to the final conclusion that it's not me being self-critical, but it did have me ask that question. But at the same time, I'm making a decision to sort of improve myself by improving my weight, by, of course, limiting like possible diseases and things like that. And then when I started, I haven't done like a deep dive into the medication, but the one that we settled on between Mounjaro and Ozempic was Mounjaro. I guess he liked some of the benefits of it more than the Ozempic or whatever. So I have to read more about it, but I wondered for you all out there if you have taken any of these GLP-1 medications that are to go ahead and either relieve like some of the weight that you have. And I know a lot of these medications are really for diabetics. I'm not diabetic. And I was like, okay, I want to make sure, because I know at one time it was like a big, frenzy for this. And they were like having, a shortage of the medication because people were using them for weight loss and people really needed the medication for diabetes. So he goes, no, all of that is stabilized, everything is cool or whatever. But yeah, so I just wanted to ask you guys if you knew anything about any of these GLP-1 medications. Have you had any experiences with them? This is a fairly new channel, so I don't, anticipate getting a flood of responses. But yeah, so it was just one personal thing that was somewhat like, just had me trying to do, like I said, a evaluation to see if this is the way that I want to go. To go ahead and get the weight off and then, try to maintain it and so forth. So yeah, so if you could just answer and see if you have known anyone that have had any experiences with these, how they did, how they cope with it, how were the side effects, which that was the big thing for me. You take one thing and then you have like a whole new set of another situation occur from that one situation. So yeah, so like I said, initially the video was just going to be about diving into that that topic of self-criticism, which this, like I said, was sort of tottering that. But yeah, so I just wanted to give some personal insight of what I was thinking about this Monday and how I'm just trying to navigate, trying to make sure that I'm making the right decision, to be healthy and then, being healthy in both aspects, mental health and then also, physical health. So, I think I pretty much am okay with the portion of, me being too harsh on myself, saying, okay, yeah, you need to lose some weight, but also this could, create some other benefits or whatever. And I haven't really shared this with any of my family, my friends, just mainly my husband, my doctor. So I don't have the medication yet, but it is going through the authorization process as we speak to have it shipped to me. And that's another thing. I'm not fond of sticking myself. So I'm like, it's an injectable. Then you have to find different places on your body to stick it, stick it in your stomach, your thigh. Then it has to be a different place each time. I'm like, oh my God, do I really want to do this? But anyway, that's just what I was thinking about today. So if anyone could just chime in to see if they have any experience with this or if they if they think that it works well, if someone has had like some bad things to occur, because I think I'm gonna plan on trying to take it and then like sort of give like how it's making me feel, here to give like little feedback every so often. Like I said, I don't know anyone personally that has taken this. Of course, we see celebrities like Oprah, having a platform saying that she's on Ozempic or whatever, and it's doing great things for her, but she still leads a healthy lifestyle with exercise and eating right and things like that. So that's all that I really wanted to dive in today. Thanks for listening, and I would really be eager to see your comments on how this weight loss type of situation has been with you or people that you know. So thanks for listening, and take care and be well.